Hi, my name is James Coetzee. It's the 28th of September 2012 and my client is Kate Forbes. I've been instructed by Belinda Fong to complete a dumbbell bench press and the elliptical trainer / stepper as two of my exercises, as we don't have a rower or barbells to complete the bench press in our gym. Thank you and enjoy. Hi, I'm James, you must be Kate.
Yes.
Welcome to the gym. Is this your first time down here today?
Yes.
Excellent. Well, Kate, what's brought you down here today?
I had a baby a little while ago and I'm just looking to do some of the weight I put on.
Fantastic. Well, the good news is that you've taken the first step. Gyms can be quite intimidating, so you're already one step ahead of most people. Now, what we're hoping to do today is take you for a bit of a tour of the gym, show you the equipment and the facilities, and then what we'll do is we're going to sit down and work on a program for you, focusing on your key goals and how to achieve them in a safe and efficient manner. And of course, we want to have some fun. How does that sound?
Sounds good.
Fantastic, let's go. Okay, Kate, so we've had a tour around the gym, given you a better idea of the facilities and also the equipment, and also pointed out one or two safety and etiquette issues within the gym. What we're going to do now is a personal needs analysis. We're just going to try and find out a little bit about your sporting and exercise history, as well as that we're going to try and find out what your key goal is for coming to the gym. So let's start off. Your name is Kate. Your surname?
Forbes.
That's F-O-R-B-E-S. Age?
37.
And today is the 28th of September 2012. Your address, Kate?
152 Hague Road. Unit 1006.
1006.
Hague Court.
Hague Court. That's Singapore. And the postcode?
438791.
Fantastic. Are you or have you been doing exercise or playing any sport? If so, please describe.
Just been doing yoga, Pilates and some walking.
Okay, so yoga, Pilates, and walking. Have you ever been a member of a gym?
No.
No. How would you describe your current health and fitness?
Average. Okay.
Average. Okay, average. Now, what we're going to hope to achieve out of this next section is we're going to give each of the key goals a numerical value. 1 being very important, 3 being mostly important, and 5 not being important. Okay? So the key goals we're going to work on today are improve general fitness.
1.
1. Increase cardio fitness.
1.
Increase energy levels.
2.
2. Increase muscle strength.
1.
Increase muscle mass.
5.
5. Increase muscle definition.
1.
Reduce body fat.
1.
Tone up.
1.
Improve flexibility.
3.
3. And reduce stress.
3.
3. Are there any other goals that are fairly important to you?
No.
No. Okay, so none. How long have you been thinking about these goals, Kate, in terms of weeks, months, years?
About a year.
About a year. Okay. Are there any reasons why you can't achieve these goals?
Mostly just time constraints.
Time constraints, and is that work or family related or a bit of both?
Both.
Both. Okay, so work commitments. Okay. Is your job physical or sedentary?
Sedentary.
Sedentary. Are you following any particular eating plan or diet?
No.
Okay. How much time can you dedicate to an exercise program? Minutes per day and days per week?
Probably an hour to an hour and a half, 3 times a week.
So 1 to 1.5 hours and 3 times a week. Okay. Types of exercises and activities that interest you. Walking,
Yes.
running,
Yes.
stationary cycling,
Yes.
machine rowing.
No.
Okay. Swimming,
Yes.
cross trainer,
Yes.
weight machines,
Yes.
free weights,
Yes.
stretching,
Yes.
and sports.
Yes.
Or just general sports. Yeah. Okay. Group exercises. We do know already that you do take part in Pilates and yoga classes. Now, on what days of the week are you taking those classes?
Normally do Pilates on a Tuesday and yoga on a Saturday.
Tuesday and yoga on Saturday. Fantastic. So now, Kate, what we're going to try and do is, from the information we've got here, we're going to try and work on a SMART goal for you. Now, a SMART goal is a specific, measurable, achievable, realistic, and has got a time frame to it. From what you've told me, obviously you're hoping to get fitter, lose some weight, as well as tone up. Which of those is the most important to you?
Losing weight.
Losing weight. And what is your goal weight that you're trying to achieve, or what's the loss that you're looking for?
About 6 kilos.
About 6 kilograms. And in what sort of time period?
As soon as possible.
Soon.
Next month.
Next month? Okay. So you're ideally hoping to lose 6 kilograms in about a 4-week period, which is doable, but due to your time constraints and the amount of time that you can offer to a gym program, possibly not quite realistic. So what I'm going to do is I'm going to suggest a solution for you. What I'm going to say is, let's work on a 4 kilogram weight loss over a 6-week period. Now that means that you're not losing a bulk of weight in a week, in any given week over that 6-week period. But and also we've got to take into account your physical fitness. So if you were already physically fit, then we can push you really hard in the gym and you'd lose weight quite quickly. But because you're a novice to the gym, we want to slowly work you into it. So I believe that a 4 kilogram loss over a 6-week period that's specific. So we're losing 4 kilograms, we're doing it over 6 weeks, which is your time frame. It's measurable in kilograms lost, achievable because we're not trying to bite off too much of the apple, and it's realistic in the fact that I'm pretty certain we can get you to lose 4 kilograms in a 6-week period. That's going to do 2 things for you. It's going to keep you enthused and make you want to come back to the gym. If we were to make an unrealistic target, what will happen is you'll lose your motivation because you're not achieving it. So, 4 kilograms in 6 weeks, measured in weight loss over a 6-week period. How does that sound?
Sounds good.
Fantastic. Now, we're going to move on to the next section of our questionnaire. This is the pre-exercise questionnaire, and what we're hoping to achieve out of this is we want to find out a little bit more about your family and your own personal medical history. So we're going to go through a couple of the same ones. Name we've got already. It's Kate Forbes. Your age is 37 years old. You're female. Your address is 152 Hague Road, Unit 1006, Hague Court, Singapore, 438791. Your occupation, Kate?
Banking.
Banking. Your work phone number?
Is 6349
6349
7043.
7043. Home phone number?
6498
6498
1762.
1762. And your mobile?
9641
9641
5440.
0. Okay. Person to be contacted in case of an accident?
My husband James.
James. Is he also Forbes?
It's Coetzee, COETZEE.
Okay. His work phone number?
is his mobile, which is 9751
9751.
7717.
Okay, home phone number the same as yours, I presume?
Yeah.
64981762, and his mobile and his work number 7975177717. Fantastic, Kat. Now, the next part is about medical history. Have you ever had, or do you have, any of the following? Just yell out if any of them are applicable. Anyone in your family under 60 who has suffered from heart disease, stroke, raised cholesterol, or sudden death?
No.
Are you a male over 35 or female over 45 and not used to vigorous exercise?
No.
Are you on any prescription medication?
Yes.
Yes, okay. Sorry, I'm just going to make a little note here, flag that. Yes, and I just want to make a comment on the back of the page here. The medication is?
Thyroxine.
Okay. Thyroxine. And that is for?
For underactive thyroid.
Thyroid. Okay, now you have got doctor's clearance with this condition that you can come to the gym. It doesn't affect your gym, or it does?
It doesn't affect.
It doesn't affect. Okay, so it doesn't affect exercise. No problem. Okay. Have you been hospitalised recently?
No.
Have you given birth in the last 6 weeks?
No.
Are you pregnant?
No.
Okay, fantastic. Do you have or have you had any of the following? Gout,
No.
stroke,
No.
dizziness or fainting,
No.
stomach or duodenal ulcer,
No.
liver or kidney conditions,
No.
glandular fever,
No.
heart murmur,
No.
high blood pressure above 140 over 90, sorry.
No.
Okay. Palpitations or chest pains,
No.
raised cholesterol or triglycerides,
No.
any heart conditions,
No.
diabetes,
No.
epilepsy,
No.
hernia,
No.
rheumatic fever.
No.
No. Okay. Okay, what I'll ask you to do now is, if you wouldn't mind just giving us a clearance signature there in today's date that your condition is not going to affect the total. It's 28th of September today. Fantastic. Okay. Now, we'll just keep on the same questionnaire, just a few more medical concerns. Have you ever had, or do you have, arthritis,
No.
asthma?
Yes, but it's only mild.
Okay, again, sorry, let me just make a note over here. So you do have asthma, mild. Any medication for that?
I have a Ventolin, but I rarely use it.
Okay, Ventolin, rarely used. Fantastic. Okay. Cramps?
No.
Are you dieting or fasting?
No.
Any pain or major injuries to any of the following areas? Neck,
No.
knees,
No.
shoulders,
No.
back,
No.
ankles?
No.
Any muscular pain?
No.
Okay. And do you smoke?
No.
Are there any other conditions which may be reason to modify this program?
No.
No. Okay. What exercise have you been doing recently? How long for? The duration of the exercise and how often?
I do yoga and Pilates once a week each.
Okay, so yoga and Pilates, we did run through that just before. How long have you been doing that in terms of?
About 10 years.
About 10 years. Okay. Duration?
An hour each class.
An hour, so 60 minutes each class. And how often do you do that?
Once each week.
Once each week, so, okay, so once each. No problem. The intensity level of your classes, are they hard, medium or light?
Medium.
Medium. Okay. Kate, what I'll ask you to do now is just read through the next section here in the statement. If you're all agreeable to that, what I'll ask you to do is just give a signature with today's date, and then I'll authorise that afterwards. Excellent. So that gets that out of the way. Now, the last thing we're going to do in this assessment, in terms of medical and your history, we're going to do a blood pressure test. Now, the blood pressure test is fairly important. What we're looking for here, regular blood pressure is 120/80, where most people fit into that. Above that, when you get up to around 140/90, you're starting to become borderline. Borderline meaning anything over and above that, you start getting into the category of hypertension. Hypertension is possibly dangerous while doing exercise. So we need to establish if you are or do have a higher blood pressure, there's certain exercises you can't do, and we also need to get a doctor's clearance from that. So if you give me just a moment, I'll get my equipment out here. So don't be frightened by it. It's a simple piece of medical equipment. What we're going to do is attach this to your arm, left or right arm. I'll get one of those from you in just a second. And we're going to place the cuff on your arm. We're going to pump it up to about 200 measures of mercury. Then we're going to slowly reduce the pressure in it by about 2 or 3 measures of mercury a second. What we're then going to listen for is the first pulsation that we hear is going to be your systolic blood pressure. And what that is when your heart's contracting and it's basically pumping blood through your arteries and veins. So that is the first reading. The second reading is your diastolic, and that is when your heart's at rest. The pressure in your vein, now your veins and arteries have got to have pressure in them, otherwise they would collapse. Okay? And we listen for that. So once we hear the first pulse, it's going to pulse all the way through. It will then start getting muffled, and the very last sound we hear. So systolic, first sound we hear, diastolic, the last sound that we hear. So if you wouldn't mind, make sure there's no air in the cup. Left or right arm, whichever one you're more comfortable with. Okay, if you wouldn't mind just slipping your arm through there. And then rest it down on the table. We're going to place that just about over here. Wrap it around your arm. I'm going to insert these into my ears so I can hear nicely. Now, if at any stage you do feel any discomfort, please let me know and we can stop straight away. Okay, Kate, fantastic. Well, the good news is that your blood pressure is almost exactly along the lines of the normal mark. You are 118/80, so that's considered normal. So let's just jot that down. So we've got a record of it. Your systolic pressure was 118, diastolic 80. Normal blood pressure, 120/80. So you are considered normal. Fantastic. Now we've got that all out of the way, what we can do is get down to writing your program to try and meet your key goals in an efficient and safe manner, and of course it's got to be enjoyable. So let's leave it at that. I'll write a program for you and let's meet later in the week to get you started in the gym. How does that sound?
Sounds good.
Fantastic. Okay, this is the stationary cycle or stationary bike. It's a great piece of equipment for cardio training because it simulates riding, bicycle riding. So I'm going to give you a quick demonstration. First of all, it's got a couple of functions on the electronic pad here. We've got heart rate monitors, we've got a quick start function, as well as a bunch of preset functions. So you can do cross country, you can do hill climbs, you can do random, you can do interval training, all through the controls on the pad. Okay? So what we're going to do first and foremost, we need to ensure that we set the bike up correctly. So what you want to do is you want to have the saddle at approximately hip height. We want to grab onto the handlebars, place our foot into the pedal, get it down to the 6 o'clock position, and then lift yourself up and over, sit down in the seat, place your feet into the other side. Then adjust the foot straps so your feet are nice and securely fastened with your balls of your feet on the pedal. Okay. Now, important things to remember with this is keep your sternum and your pubic bone aligned. Make sure your knees are always traveling in line with your toes and that you've got no movement in your hips. When we got the pedal down at the 6 o'clock mark, we want to make sure we've got a slight bend in the knee. That will also help with the zero movement in the hips. Now, grab hold of the handlebars and start pedaling. That will activate your control. So what we're going to do is we're going to run with a quick start function today. We've got a couple of different settings over here. The resistance is the resistance of the bike against your pedal. So basically the force that you're going to put into it. So we'll increase the resistance slightly. If at any stage during the exercise you do feel fatigued, lightheaded or faint, all you do is you slowly reduce your speed back down to 0, wait for it to stop completely, and then while holding the handlebars, exit the bike. Okay, how does that sound?
Sounds okay.
Fantastic. Okay, this piece of equipment is called the treadmill. It's a fantastic piece of cardio equipment in that it allows you to simulate walking or running. So let me give you a quick demonstration. Again, we've got our control panel over here. It has a number of different functions on it, including a quick start, as well as some preset programs, which you operate through the reset, enter, and control buttons over here. So, I'll give you a quick demonstration of how it works. What we want to do is we want to grab hold of the handle, place one foot on the side, grab hold of the handle on the other side, and then raise yourself over, keeping your feet on the sides, holding onto the handle. Now what we're going to do is we're going to attach the safety cord. Basically what the safety cord is for is if at any stage you do slip, trip, fall, or feel faint and pass out, this here will switch the treadmill off straight away. With a tug, it cancels it off. So what we're going to do is we're going to attach that, get ourselves in position, hit the quick start button, 3, 2, 1, the belt will start rolling. Now when you're feeling comfortable enough, you then step onto the belt and slowly start walking with it. Now when you're on the belt, and if at any stage you're feeling a little uncomfortable, there is the stop button, so you can hit that. You hit the stop button, and then move yourself back over to the side again. Okay? So, back on, keep going, finger on the stop button, step off to the side. The reason we step off to the side and hold the handles is, if for some reason the machine malfunctions, we're not standing on the belt if it takes off. Okay, so quick start. Okay, there we go. Good to go. Now, the last thing about the treadmill is you can increase your speed, so you can walk at a rapid rate, or you can run with it. The other nice thing about it is it has an incline function, so you can actually raise the machine up to the point where you feel you either want to increase your exercise rate, or alternatively you feel like you can do it on. Another good thing to remember is to keep your hands up at your side while using it. It just helps to increase your cardio. Okay, so what we're going to do now, keep the knees nice and soft all the way through. You want to keep the knees going over your toes. So what we're going to do now is we're going to lower the machine back down to its press position. Attach the safety cord, and then we're done. Holding onto the rails, step yourself off, and that's that one done. How does that go?
Okay.
Fantastic. The next piece of equipment we're looking at is a cross trainer or elliptical trainer. This is a great piece of equipment for cardio training due to the fact that it simulates running and walking. Now, it does it in a slightly different way to a treadmill. It supports your legs right the way through the motion. So, with this one, I'll give you a quick demonstration. Again, we've got our electronic pad up here. It's got a number of different functions, one of them being quick start, as well as a range of preset functions. Okay, so to enter this machine, what we do is we grab hold of, it's got a fixed and movable handles. So we're going to grab hold of the fixed handles, we're going to lift the foot on, lift the other foot on. Okay, now when we're getting ourselves set up, we want to ensure that our knees are running directly over our toes, that our sternum and pubic bones are aligned, our shoulders are relaxed and back, and then to get the machine going, we just start off nice and soft and gentle. Okay, we're going to use the quick start function today, so we'll hit the quick start function, and it too has a resistance button, so you can increase the resistance to simulate and to build the resistance up to where you need it to be for your exercise. Once you're comfortable and you're moving in good motion, you want to keep your hips nice and level, knees nice and soft. Grab hold of the handles, and then off you go. If at any stage during the exercise you're feeling light-headed, faint, or uncomfortable, all you do is you just slowly slow your legs down to the point where the machine stops. Grab hold of the fixed handles and lower yourself off the machine. How does that look?
Okay.
Fantastic. So this is our machine weight section of the gym. It's a multi-station section. So a couple of things to remember with this is when there are other people using the equipment around here, please be careful to not step in or out of anything while someone else is using it, just to try and avoid any accidents of getting hit in the head with the bar or in the legs with one of the other pieces of equipment. Something else to remember, always ensure that the pin is nice and secure before you start using that piece of equipment. And another thing, it's just good etiquette to always make sure each piece of equipment is returned back to its correct resting place and doing all of that. Okay? How's that sound?
Great.
Fantastic. So Kate, this here, we've had a look at the machine weight section. This is our free weight section, our dumbbell section. Okay? Our gym over here unfortunately doesn't have any barbells, but barbells are basically an extension of this. It's generally about 2 meters long and with the weights on the outside. But dumbbells are very, very effective. Now, a couple of things to remember in this section. You're often going to use these weights just standing, but you can also use them with the bench. Now, again, just good gym etiquette. Always use a towel. Always keep a towel with you in the gym. And when you're using one of the benches or anything you're going to lie up against while you're sweating, remember to put a towel on just so someone else doesn't have to deal with your sweat afterwards. Another good piece of advice is, once you've used your dumbbells, don't leave them lying around on the floor, just in case someone walks past and trips over them. So it's always a bit safer to pick them up and return them back onto the rack. Another thing is, make sure you don't take too much weight. When you're working with these weights, make sure that they're of the right weight to suit you, and don't try and overdo it too soon. How does that sound?
Okay.
Fantastic. Okay, Kat, so the next exercise we're going to do is leg press. Leg press works 3 muscle groups in the leg: the quadricep, the hamstring, and the gluteals, with a predominant focus on the gluteals. Now, the gluteals originate from the iliac crest, the sacrum, and the coccyx, and insert into the femur and the ITD band. Now, first thing we need to do is ensure that the weight that we've selected is correct. So we've gone with the 10 kilogram weight for you today. So pop on over here quick to the weight stack. We check. We've got 10 kilograms selected, and that pins in nice and secure. Okay, pop on over here. Now we want to set the machine up. So what we do is we step over, lower ourselves down onto the seat, place our backs nice and firmly up against, and ensure that our sternum and pubic bones are aligned. We lift our feet up onto the plates, ensuring that our feet are approximately hip width apart, that our knees are aligned with our feet, and that we've got close enough to a 90-degree angle to start off with. Then what we want to do is when we put the force through, we're going to push through our feet and our heels. We don't want our heels to come off the plates at any stage. Okay? So, what we're going to do, grab hold of the handles, activate your core to keep your upper body nice and aligned. Take a deep breath in, breathe out, push out to just short of lock. We never want to get down to lock. Breathe in, back up to 90 degrees. Breathe out, and down, and breathe in, breathe out, breathe in, back up to 90, and one last one, breathe out, breathe in, and then relax the plate back, drop your feet, and you can use the plates to lift yourself back out of the machine again. Okay, how does that look? Fantastic. Come grab a seat, let's ensure that the setup's all correct for you. Now, back nice and firmly up against there. Ensure that you've got a good alignment through the pubic bone and the sternum. Okay, raise your feet up onto the plates. Okay, so what we want to do here is we want to ensure that we've got hip width apart. Okay, knees are in line with your feet. And that we've got close enough to a 90-degree angle, which we've got. Okay, I'm going to pop around this side. So, nice straight back. Activate your core for a bit of additional strengthening. Take a deep breath in and push out. Okay, just short of lock. And back, up to 90. And push out. Okay, and breathe in. Back up to the top. And push out. 3, and breathe in, and push out, 4, and breathe in, and push out, and keep your nice alignment between your knees and your feet, and 5, okay, and breathe out, okay, so there you went wrong, your feet have got to stay positioned on the plate flat the whole time, and push out. That's it. Okay, and back, and push out, correct, and back, and try not to drop in too far. Okay, stop there, don't lift your toes up. Okay, and back, and one last one, and breathe out. Okay, so quite important on this exercise is that you keep your feet positioned flat on the plates at all times. Don't roll your toes up, don't lift your heels up, okay? But other than that, that was pretty good. What we'll do is we'll come back and we'll try it again in a short while. How does that sound? Fantastic. So guys, the next exercise we're going to do is the lat pull down, okay? This exercise focuses primarily on the latissimus dorsi muscle. It originates from the sacrum, the lumbar vertebra, and the lower 7th thoracic vertebra, and inserts into the humerus, underneath. So what we want to do first is we want to ensure that we've got the correct weights for the exercise. So today we're going to work on 10 kilograms, which works within your programming. So we'll get the pin, pop it into the 10, make sure it's securely in there. Next thing we want to do is step onto the machine. We want to take a seat, ensuring that the knee pad are left at a 90-degree knee pad and your knees are securely under, and be able to put your hands just underneath. Okay? Once we've got the knee pad correctly adjusted, what we're going to do is we're going to stand up. We're going to take the bar at 1.5 times shoulders width. So shoulders width plus a half, just about there. Now we're going to lower ourselves back in. Get our knees securely planted underneath the pad. Ensure that our pubic bone and sternum are aligned. We're going to take a deep breath in. And exhale. Lower the bar down to just below our chin, near our chest. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. And last one. Exhale down. Inhale up. Now, to exit the machine, we're going to release our knees, stand back, and release the bar up to the top, nice and gently. Okay. How does that look? Fantastic. So, first thing we'll do, let's just check the weight stack again. We've got the 10 kilograms, just ensure that the pin's in there nice and secure. Fantastic. Let's get you seated on the bench. Let's adjust the pad, just to be sure. Okay, that's nice. Your legs are nice and secure underneath. You've got a good 90-degree angle. Okay, let's stand up. So, shoulder width plus a half. Okay, perfect. So lower yourself down nice and gently. Get your legs under the pad, 90 degrees. Okay, let's ensure that your sternum and pubic bones are aligned. Your back's nice and straight. Shoulders relaxed. Take a deep breath in. Okay, and lower down, breathing out. Okay, up. 1. We're going to do 10. 2. 3. Keep that back nice and straight. 4. Breathe out on the way down, in on the way out. 5. 6. 7. 8. 9. And 10. Last one. Now release the bar back up. Slowly move yourself back out from under the pad. And release it back. Perfect. Now, on that one, did you feel towards the end of the exercise that you were getting a little bit of burn in your lats?
Yes.
So towards the last 2 or 3?
Yeah.
Fantastic. That works in perfectly with the program. Okay, Kate, so the exercise we're about to do is called the dumbbell bench press. And what it does is it focuses predominantly on the pectoral muscles. The pectoral muscles originate from the sternum, clavicle and ribs, and insert into the humerus. Now, what we're going to do is we've got 3 kilograms per side weight for you, which fits within your program, and is a safe weight for you to go minimize. So I'm going to give you a demonstration of how the exercise should be done, and then we'll move on to you. And when we get to your side of the exercise, we're going to do 10 repetitions, and I'm going to give you a light spot just to help you and assist you with the alignment of the exercise. Okay, so we've got our weights over here. We lift them up. We get our feet planted about hip width apart. And then we lower ourselves down onto the bench, ensuring that we've got enough space so that when we do roll back, our feet are still planted on the floor. We lift the weights up to our shoulders and slowly roll ourselves back onto the bench. Okay, at this point, it is fairly important to ensure that the back is flat, that your sternum and your pubic bones are aligned, and that your feet are flat on the floor. Then we're going to take a deep breath in, and exhale, push the weights up. Now at this point, we want to ensure that our palms are facing forward, knuckles are facing towards the ceiling, and that our wrists are above our elbows, and that the weights
bench height, no more than that, at about a 90-degree angle. And breathe out, back up to the top. Breathe in, coming down. Breathe out, going up. Breathe in, going down. Breathe out, going up. Breathe in, going down. Breathe out, going up. Okay, to exit the exercise, what we do is we lower the weights down to our abdomen and then use our abdominal muscles to roll ourselves out of the exercise.
Okay. From there, we take the weights and we replace them back on the weight rack. But we're going to get you to do the exercise now, so we're going to leave them just over here for you to try. Okay. So what I'd like you to do, Kate, position yourself in front of the bench. Take a step forward, so you're a little way away from the bench. That's right. Bend down and use your knees to bend, not your back. Okay. So get your feet about a hip width apart. Excellent. Now slowly lower yourself down onto the bench. Okay. Now raise the weights up to shoulder height and roll yourself back onto the bench. Okay. Now it's important at this stage to ensure that your back is flat on the bench, your sternum and your pubic bones are aligned, and that your feet are flat. So what we'd like you to do now, I'll get you to take a deep breath in and breathe out and raise the weights up just to there. Perfect. So knuckles facing up towards the roof, palms facing forward, and wrists above the elbows. Okay, so we're going to take a deep breath in and lower them down to 90 degrees, down a little more. There we go. Okay, and then squeeze your pecs up and breathe out. And again, in and out. And in and out. 3. And in and out. 4. And in and out. 5. And in and out. 6. And remember to squeeze those pectorals. And out. 7. And 8. And out. 9. And in. Last one. 10. Perfect. Okay, so from there, lower them down to your abdomen and then use your body to roll yourself out. How did that feel?
Okay.
Fantastic. Now, towards the end of the exercise, did you start feeling a little bit of burn in your chest?
A little bit.
Excellent. That's what we're hoping to achieve. So when you're doing the exercise towards the end of your repetitions, to know that your weights are correct, through the last 2 or 3 pushes of the exercise, you want to make sure that you're just getting a little bit of burn, that it is starting, you're starting to feel it. Excellent, Kate, well done. Okay, Kate, next exercise we're going to do is a lateral raise. The lateral raise works on the deltoid. The deltoid originates from the clavicle and scapula and inserts into the humerus. For this exercise, we're going to use dumbbells. And we've gone with a nice light dumbbell, 2 kilograms this time, which works within the exercise program that we worked out for you. So for this exercise, what we want to do is we want to plant our feet nice and firmly at about shoulders width. We want to roll our shoulders back and relax them, keep our sternum and pubic bones aligned, and a slight bend in the knees. So we're going to start the weight off just in front of our thighs. Slight bend in the elbows. Take a deep breath in. Breathe out. Up to shoulder height. Breathe in. Down to the bottom. Up to shoulder height. Into the bottom. Up to shoulder height. Into the bottom. Up to shoulder height. Into the bottom. Okay, when we've finished the exercise, you can relax your arms and return the weights back to the weight rack. Okay, now we're going to get you to do the exercise this time. We're going to do 10 repetitions. So grab the weights, 2 kilograms each side. What we'll get you to do is stand. So get your feet nice and planted, shoulder width apart, slight bend in the knees. Keep them nice and soft. Roll your shoulders back and relax them. Keep your sternum and pubic bones aligned. Okay, I'm going to come stand behind you. Elbows slightly bent, weights in front of the thighs. Deep breath in. Okay, and out, up to shoulder height. 1. And down, in, and up, out. 2. And down and in, and up and out. 3. Down and in, up and out. 4. Good work. Down and in, up and out. 5. Keep your back nice and straight. 6. Knees nice and soft. 7. 8. Keep that breathing up. 9. And last one. 10. Now relax down to position. You can relax your arms down. Step out of your position and place the weights back on the rack. Now with that one, Kate, did you feel towards the end of the exercise, the last 2 or 3 repetitions, a bit of burning in your shoulders?
Yes.
Fantastic, that's what we're hoping to achieve with all the exercise. That way we know that the weights are about right for where you are at the moment. Okay, Kate, so the exercise we're going to do now is the static lunge. What the static lunge does is it focuses primarily on the quadricep. The quadricep originates from the ilium, femur, and inserts into the tibia. A very important muscle group for day-to-day use. Every time you stand up from a chair, climb a stair, walk around, run, that's one of the main muscle groups that are being used. So what I'm going to do is I'm going to demonstrate it for you quickly, and then I'll get you to do it. So, key factors to this exercise are, you need to stand with your feet about hip width apart. Ensure your back straight and that your sternum and pubic bones are aligned. Roll your shoulders back, put your hands on your hips. Now you want to paint a mental railway line out in front of your feet so that every time you step out onto the railway line. Okay, so what we want to do is we're going to take a step forward, far enough that our heel comes off the ground at the back, then we're going to drop our back leg to create 290 degrees and up and back. Okay, now we also want to remember that breathing on this exercise is you take a deep breath in, stepping forward, and you breathe out while going back. So, breath in, down, back. Breathe in, down, breathe in, back, breathe in, down, back. Okay, how does that look? Fantastic. So what we'll get now is I'll get you to come stand over here. So key factors to remember, back straight at all times, pubic bone and sternum aligned. As well as that, we want to make sure that we've got a 90-degree angle on your knees when you bend and you breathe in. So, breathe in on your forward stroke and breathe out while going back. Okay, so hands on your hips, feet hip width apart, perfect. And then what we're going to do, make sure your back's straight and your shoulders are all back. Okay, so I'm going to give you assistance here. I'm going to lead with the right foot. We're going to do 10 repetitions. Breathing in, going forward, breathing out, going back. Okay, let's go. First one. Down. Breathe out. Okay, breathe in, step forward. Breathe out, back. Okay. Down, up, out. Perfect. And again. Down. Now ensure that your back steps straight. Okay, and 5, back, and 6, okay, down, that's it, and 7, down, out, breathe in, 8, okay, and 9, back, and last one, 10, down, up, back, perfect. Okay, just a couple of things to keep in mind. Your Technique is fairly good. The only thing we've just got to try and focus on a little bit is your front knee. When you're going forward, you are a little bit over your foot. Try and drop with the back knee a little more. Okay? Other than that, well done. Congratulations. So, okay, the next exercise we're going to do is the lying leg extension. It focuses on the rectus abdominis that originate from your pubis symphysis and insert into your 5th to 7th rib. Okay, so for this exercise, I'll give you a quick demonstration and we'll get you to do it. So what we want to do, you need to place your mat on the floor, stand in front of the mat, turn yourself around, lower yourself down to the mat. Okay, make sure your feet are placed on the floor at about 2 foot apart. Roll yourself back onto the mat. Place your hands along the side of your body on the inside. Make sure your back's flat on the floor and that your sternum and pubic bones are aligned. Then what we're going to do is with the feet flat on the floor, we're going to raise both our legs up so they're about 90 degrees. Then we're going to do, take a deep breath in and lower leg down, breathe out, raise it up. Okay, breath in, lower the leg down, breath out, raise it up. Okay, and again, breathe in, lower the leg down, breathe out, raise it up. Breathe out, in, lower the leg down, breathe out, raise it up. Last one, breathe in, breathe out. Okay, and then what we're going to do is we're going to roll into the side, get up on your knees, bring your feet in underneath, and exit. Okay, so what we'll do now is we'll get you to try the exercise. So, in front of the mat, lower yourself down. Okay, keep your feet flat on the floor. Move yourself down a little, that's it. Hands flat on the floor. Your sternum and pubic bones align. Back's flat on the floor, hands alongside. Now what I want you to do is raise your legs up. So they're both at 90 degrees. Okay, take a deep breath in. Now when you lower your legs down, you want to make sure you lower your legs so your back doesn't lift up and you're also not arching your stomach. Okay, so breathe in and down. Okay, up. 1. Breathe in, down, up and out. 2. And down, and up and out. 3. And down, up and out. 4. Down, and up and out. 6. Yeah, good work. Down, up and out. 7. And again, down. Make sure the stomach's nice and flat and your back's on the floor. 8. And down. And up and out. And last one, down, up and out. Fantastic. Lower your feet down to the floor so they're both flat. Roll yourself over onto your side. Onto your knees, pull your feet in under your knees. And raise yourself up. Excellent. How did that feel?
Not too bad.
Excellent. Well done. Okay, the final part of our exercise program is going to be stretching. We're going to run through a range of static stretches. Now, stretching is important because it helps reduce the risk of injury, it helps reduce muscle spasm, and also stress on the joints. Now, a couple of safety things to remember. You never want to do any stretches that involve rapid bouncing or momentum. The reason for that is they are less easy to control and may lead to stress or strain or possible injury. Now, a couple of key factors, guidelines for stretching is you always want to stretch when your body is warm. So best to do it directly after a workout, and if you are going to do it before a workout, just do some casual stationary jogging just to get your muscles nice and warm. It also is very important to keep good body alignment. Breathe normally, in through your nose and out through your mouth through your stretching. And always remember to only stretch to the point of tension not pain. Okay, so the first stretch we're going to do today is the standing hamstring stretch. So what we want to do for that is we want to stand with our feet hip width apart. We're going to do our left leg first, so we're going to bend our right knee, extend our left foot out, place our weight from our hands onto our right knee, and keep your back straight, and bend your body down, put in all your weights on your right knee until you can feel the stretch through your left. Now you hold that for 20 seconds with keeping your left foot flat on the floor, and then slowly move your way out and back to stationary. Okay, we'll do that on both sides. So if you'd like to come, stand. So stand, hip width apart. We're going to do your left leg first, so onto your right knee, bend it. Okay, hands on, yeah. Now push your body down until you feel the stretch through your, can you feel the stretching through your hamstrings? So 20 seconds. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Slowly up and back to stationary, and then we'll do it on the other side as well. So foot forward, bend this knee, weight onto it, keep your back nice and straight, back straight. Okay, and 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and up. Perfect. Okay, next exercise we're going to do is going to be the standing tricep stretch. So this one, again, we want to stand with our legs hip width apart. We're going to do our right first, so we raise our right arm up, place it behind our neck, then we take our left hand and place it on the side of our elbow, pulling it gently towards your head without poking your head out forward until you feel the stretch, and hold it for 20. Okay, so what we'll get you to do is, if you wouldn't mind coming over, so important, keep your feet hip width apart. You're standing in the pubic bone line, so good alignment through your back. So your right arm up, over behind your neck, left hand over the top of your head, and then gently pull until you feel the stretch without poking your head out forward. So we go 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Slowly release back down to your hands both. Okay, left hand up and over behind your neck. Right over your head. Grab your elbow and gently pull it until you feel the stretch through there. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and release. Okay, the last stretch we're going to do today is going to be a standing upper back stretch, and it's going to focus predominantly on the rhomboids. Okay, so for this exercise, stand again, feet hip width apart, hands on your side, raise them up in front of you, and roll your arms over so your palms are facing away from you. Then we want to make sure that our pubic bone and our sternum are aligned. We want to push our fingers away from us, pulling our chest back, rounding our shoulders out, and opening up our shoulder blades. And we hold that for 20 seconds, and then release. Back up and down. So if you'd like to give it a quick go. Okay, so hands up, roll over, yeah, just like that. So now we want to push out through our fingers, roll our shoulders forward, and open our shoulder blades up. Fantastic. And 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And slowly roll back. Lower your hands down alongside your body. All done. How did that feel?
Good.
Fantastic. Okay, well, thank you very much. That gets to the end of our training for today, and we'll hope to see you next time in the gym.
Okay. Bye.
Bye.